Good day, everyone. Today, our group will talk about Hildegard Peplau, Interpersonal Relations Theory. Introducing our team members, start with Flora Bernadette anak Cordelis Ronan, Anur Shafila binti Sofwan, Nurmalisa binti Abdullah, Azwaliza Aisyah binti Kamis, Erika Sawai anak Julin, and Ayuni Hazira binti Daniel Liting. And this is our table of content. We'll start off with sharing about professional background of Hildegard Peplau and the meta-paradigm concepts according to Peplau. And then we'll share about a case scenario related and the application of Peplau's theory. We'll also talk about the nursing process based on Peplau's theory and the nursing care plan related. Lastly, we will proceed with the conclusion related to our presentation.
So for the Hildegard Peplau early life, she was born on September 1st, 1909 in Reading, Pennsylvania. She grew up in German immigrant family. Also, she witnessed the 1918 flu epidemic influencing her future career. And lastly, she rejected traditional women's roles early in for the education. 1931, she graduated from Potsdam Hospital School of Nursing. 1943, bachelor's degree in interpersonal psychology, Bennington College, Vermont. So, also, she studied under Erich Fromm, Frida from Richmond, and Harris Tex Sullivan. And lastly, in 1947, she had her master's and doctorate degrees at Teachers College, Columbia University.
Next, we are going to talk about the career and achievements by Hildegard Peplau. The first one, she served in the Army Nurse Corps from 1943 to 1945. She helped develop the National Mental Health Act of 1946. She also created the first graduate program to psychiatric nursing specialists at Rutgers University in the early 1950s. She is the only nurse that served as Executive Director and President of American Nurse Association, ANA. She also got 11 honorary degrees, ANA Hall of Fame, and Living Legend Award in 1996. As in here, this is the book, and this is Peplau's original book from 1952, which has been translated into 9 languages, and in 1989 was reissued in Great Britain by Macmillan of London. Moving into the next part, Hildegard Peplau has passed away in her sleep on March 17, 1999, at the age of 89 years old in Sherman Oaks, California. She left the legacy Mother of Psychiatric Nursing and Nurse of the Century.
So now we're going to see the Peplau interpersonal relation theory through the meta-paradigm lens. So first we're going to see at the Peplau. So Peplau defines health as a dynamic, forward-moving process that extends beyond the more absence of disease. So instead, it encompasses personal growth, improved functioning, and psychological well-being. So health in Peplau is deeply tied to mental and emotional resilience, where individuals develop coping mechanisms, strengthen the interpersonal relationship, and progress towards self-actualization. So, for example, when a middle-aged woman who have a chronic disease may initially feel hopeless upon starting dialysis or treatment. However, through these therapeutic communications with her nurse, she gradually can regain their confidence, joins a support group, and adopt healthier habits. So despite the illness, her sense of control and quality of life improves, which demonstrating the Peplau belief that health is a evolving psychological process. So supporting this, a study found that the intervention based on Peplau theory can reduce illness uncertainty and enhance recovery in lung cancer. The patient proving the impact of nursing patient relationship on health outcome. So next, we're going to see at the nursing side. So Peplau described nursing as a therapeutic interpersonal process where nurses assist patients through illness and life transition unlike task-oriented care. So Peplau model emphasized relationship-based practice where nurses engage in shared experience that foster patient growth. For instance, with a newly diagnosed patient struggling with medication adherence, so from a nursing acting as a teacher who can explain the prescription, answering the patient question. So this kind of collaborative approach empower the patient to improve self-management and confidence. So nurses actively participate in shared experience with patients, which help them grow emotionally and physically. This through role and communication, nurse facilitates self-understanding and help. Researchers also have highlighted how Peplau theory enhances modern practice by structuring nurses-patient interaction across care paths, reinforcing its relevance in fostering therapeutic relationships.
Hello everyone, now let's start with the concept of people in Peplau's theory. Peplau views the person primarily as an individual who seeks help, often in the context of health problem. This person is not a passive recipient of care but an active participant in their own healing journey. She emphasized that patients are capable of growth and relief, especially through their interaction with the nurse. The therapeutic relationship becomes the central venue for change. Moreover, psychological process, especially interpersonal and developmental experience, are crucial to a person's health. So, in Peplau views, understanding the person means addressing not only physical needs but emotional and social dynamic as well. Next, let's talk about the environment. While Peplau does not explicitly define the term environment, it is understood through the interpersonal and social context in which nurse-patient interaction occur. The environment encompasses social, cultural, and psychological factors that shape and influence the therapeutic process. This external element can affect how patients respond to care and engage in their own treatment. Importantly, the nurse plays a guiding role by helping patients navigate their environment. This includes supporting them in recognizing their response and coping mechanism. In doing so, the nurse fosters a support space that contributes to healing and personal growth.
Now, moving on to phases of Peplau's theory, including orientation phase, identification phase, exploitation phase, and resolution phase. Case scenario. Patient's name is Mr. B and he is 55 years old. Mr. B was diagnosed with type 2 diabetes mellitus with diabetic foot ulcer. Clinical background of Mr. B. Mr. B was admitted to the surgical ward for a non-healing diabetic foot ulcer. The ulcer shows a signs of local infection with pain score 6/10, swelling, and purulent discharge. Mr. B is on IV antibiotics, insulin sliding scale, and daily dressing changes. His diabetic is poorly controlled with HbA1c reading of 9.1% and glucose level of 16.3 mmol. Phase 1, orientation phase. Based on the scenario, the goal is to build trust and assess Mr. B's needs. First, nurse introduces self and establishes a therapeutic relationship. Then, assess Mr. B's physical condition, pain level, and wound status. Also, will identify Mr. B's emotional concerns such as fear of amputation and frustration. Lastly, observe signs of anxiety, low motivation, and lack of knowledge. Phase 2, identification phase. The goal for this phase is to work together to identify problems and begin planning care. First, Mr. B expresses specific concerns, which is fear of losing his food, confusion about care. Afterward, nurse helps him recognize his role in recovery, such as self-care practices. Nurses with set short-term goals, which is manage pain, understand wound care, basic, and monitor blood sugar. Nurses will also identify learning needs and readiness for education.
Next is phase 3, which is called the exploitation phase. In this phase, the client develops full trust in the nurse and becomes an active participant in their own treatment process. For Mr. B, this means actively engaging in wound care routines, attending educational sessions on nutrition and food care, and asking questions to clarify his understanding which shows his trust the nurse's expertise. He also begins to apply the skill he learns during the demonstration to his own daily self-care routine. Throughout this phase, the nurse provides consistent emotional support and continue to encourage independence, guiding Mr. B to make informed decisions while promoting his responsibility for his own health. Together, the nurse and Mr. B set realistic and achievable goals for
Now,
his recovery. We reach the final stage, which is phase 4, the resolution phase. This is the point where the nurse-client relationship ends and the effectiveness of the nursing process is reviewed and evaluated. By this phase, Mr. B may has developed confidence in managing his own wound care and diabetes, has met his treatment goals, and has become self-reliant in handling his condition. Before discharge, the nurse ensures that a follow-up plan is in place, especially with the diabetic foot clinic, to maintain his progress. The nurse, the nurse also provides final health education, makes sure that Mr. B is comfortable and fully prepared for long-term self-care, and closes the relationship on a positive, empowered note for the
Now,
patient. Let's look at how the nursing process aligns with Peplau's theory of interpersonal relations. Each stage of the nursing process corresponds with a phase in Peplau's model. Assessment matches the orientation phase, where the nurse gathers data about Mr. P's wound, pain level, and knowledge of diabetes. Nursing diagnosis and plan align with the identification phase, where the nurse identifies learning needs and set clear, achievable goals for wound healing. Implementation corresponds to the exploitation phase, where interventions such as education, support, and monitoring are actively carried out. Finally, evaluation takes place during the resolution phase, where we assess if the goals have been met and whether the patient is ready for discharge and
let's
self-care.
now
Now
walk
walk through the complete nursing care plan for Mr. B based on Peplau's theory. For the assessment, objective data, swelling and purulent discharge at the diabetic foot ulcer site. For the subjective data, he reports pain at a level 6 out of 10 at the ulcer site. Nursing diagnosis, a risk for infection related to impaired skin integrity secondary to the diabetic foot ulcer. For the goal, within 5 days, the patient will demonstrate proper wound care technique and shows no sign of infection. For the interventions and rationales, first, assess the wound every shift for signs of infection like redness, warmth, or discharge. Early detection prevents further complications. Second, perform and teach sterile wound dressing change as ordered. Proper technique reduces the risk of introducing pathogens. Educate Mr. B on foot hygiene and diabetic foot care to enhance his ability to prevent future wounds and infections. Fourth, encourage adequate nutrition, focusing on protein and vitamins to support wound healing and strengthens the immune system. And lastly, administer prescribed antibiotics as per physician orders. It helps to control and eliminate the infection effectively. And for the evaluation, after 5 days, Mr. B was able to demonstrate correct wound care techniques and there were no longer any signs of infection. This care plan showcased how both the nursing process and Peplau's theory can be applied effectively to provide patient-centered
Now
holistic
we have
care.
come to the end, and as for conclusion, Peplau has emphasized on patient-centered care through therapeutic relationships. Her theory also has laid the foundation for modern psychiatric nursing. Therefore, we can say that effective communication, trust, and emotional support are central and important for healing. That is all from our group. Thanks for watching, and thank you for listening, and have a great day.